Our next speaker is Cathy Brown from Australia. Apart from being a clinical hypnotherapist, meditation teacher and mentor, a group work leader, and several other things besides, she is also an author with a book titled My Answer to Cancer. The book is no work of fiction, but based on personal experience because Cathy was diagnosed with a melanoma in the late 80s. With a secondary development in the early 90s. The situation, in fact, seemed so dire that she wasn't offered any serious treatment and advised only to go home and enjoy what life she had left with her young family. However, rather than surrendering to this gloomy prognosis, it initiated instead a journey of exploration and discovery into a wide range of potentially helpful modalities, particularly where the power of the mind and belief, plus selective nutrition, can positively affect personal health. She attended wellness courses and cancer support groups for 5 years as a client, and then as a volunteer, before being invited to facilitate her own groups at Cancer Support WA. She has since produced and presented corporate wellness programs to businesses in Perth and has been a member and supervisor for the Professional Hypnotherapists of Australia organisation. Cathy now runs her own business called Life Excel, helping people change their lives through hypnotherapy. Her talk today is about the latest advances in cancer care with hypnosis. I pass you over to Cathy Brown.
Yep. Cathy, hi Cathy. Just unmute yourself. Yeah, we can hear you now.
Thank you very much for that introduction. It was quite an interesting process trying to figure out in 35 minutes what I could tell you about my 33 years in the cancer industry. So what I decided to do was to go through some of the programs that I have presented over the last 30 years and take some of the slides from that, because sometimes I think a picture tells 1,000 words. And because we are about communication, sometimes communication is about verbal, but it can also be visual. So I'll just share my screen with you. But the first thing I always say to the clients when I'm working with them, that I don't give medical advice. I'm not medically trained in any way. I come from learning from people, thousands of people that I've worked with, and vicariously I've learned about life and I've learned about cancer by listening to other people's stories and hearing their expressions of emotion and fears and what they have been able to take from the journey. But what I always want to do is empower people by knowing that there's always more choices than what they think that they have. And that's why whatever I say to people, whether it's in a presentation like this or whether it's on a one-to-one basis, you can accept or reject anything that I say. As we all know, there's no absolute truth. Everyone sees things from different perceptions, and that's the thing that we need to work with. I know working in groups, I found that there were 3 types of people would come into the groups. There were people who, I'm going to beat this cancer, nothing's going to stop me, just show me what to do. Then there were people coming in saying, I've heard there's things I can do, but I really don't know where to start. Then I've also had people come in and say, I've come here because I want to know how to die well, and nobody will talk to me about dying. So as a, working in this industry, there's a huge variety. So there's not just one way of dealing with people. So just to give a couple of stats in Australia, in 2020, there were 150,000 new cases of cancer diagnosed, and of that, there were 50,000 deaths. So with stats go with that, it says about 1 or 2 people diagnosed, 1 in 2 people, that's 50%, of our population would be diagnosed with some sort of cancer by the age of 85. Now, the reason I say that one is that a lot of people come in and say, what have I done wrong? They feel some guilt that they've not eaten the right foods, or they've not meditated enough, or they're not exercised enough. But it seems to be some of the lifestyle that we're living now, and people haven't done anything wrong. And it's about encouraging to look at some things they can do to increase their quality of life. Also, things are categorized in the most common cases: prostate, breast, colorectal, melanoma, and lung cancer. But what I found that a lot of cancers aren't about where they are in the body, it's about the person. You know, where's the person in all of this? They're the one that are dealing with it. So I often look at Cathy's cancer or Bill's cancer. To me, it didn't really matter where it was in the body. There's so many strategies we can use as hypnotherapists to support their immune systems. But it was interesting that of these 5 cancers accounted for about 60% of all cancers diagnosed in Australia. And there was only a small percentage of certain cancers, which is only about 5%, were due to an inherited faulty gene. So that comes into epigenetics. Some of you may have heard about epigenetics, others haven't. But it's how the environment, they're looking at now, Dr. Bruce Lipton is doing a lot of work in looking how the environment and other factors can change the way that genes express themselves. You know, while epigenetic changes do not alter the sequence of a person's genetic code, that can play an important role in development. So looking at what we can do, you know, sometimes genetics can load the gun, but sometimes it's the lifestyles that can pull the trigger to set these things going. What I really like about the changes of when I was diagnosed 33 years ago, or 34 years ago with the initial cancer, and then 33 with secondary, it was about one or the other. So it was about you did this, and if you did anything else, it wasn't medical stream. It was called alternative. And there seemed to be this real fight between, you know, can I do this or should I do that? And people used to struggle. But I really love now that we've moved into this age of integrative medicine. And the British Society of Integrative Medicine, the quote that they have, it's about approaching to health and healing that provides patients with individually tailored health and wellbeing programs, which are designed to address the barriers to healing. And I think that as hypnotherapists is really important, where we can be the bridge to help to break down those barriers of healing. And it provides a patient with knowledge, skill, and support to take better care of themselves, physically, emotionally, psychologically, and spiritually. It's the whole person. And quite often I say to people, it's like sitting on a chair. You know, you've got 4 legs on the chair that keep you solid, and you can wiggle around. But if you take one of those away, you tip over. So you need to address, you know, the 4 aspects of who you are to create that sense of health and well-being. So, you know, some of the barriers to healing that I've observed over the time is fear, the fear that comes up. Some people can't even say the word cancer. They call it the big C, or they won't tell people. We've had people that won't even tell their family, or especially their work, because they're really scared that they'll lose their job because they've got cancer. So it's really good to open up. But what is it you're fearing? Sometimes it's the treatment. And I'm going to talk about the language around the treatments of cancer. But the thing with fear is to acknowledge it. And when you acknowledge it, pull it apart and look at it, it loses a lot of its power. Sometimes there's shame. It's their own self-esteem. They feel they're not good enough. You know, I've not done this, and they're really belting themselves up. And once again, as hypnotherapists, that's a wonderful way that we can use for self-esteem, building that self-esteem. And I think that's one of the real foundations that we can work with. One of the big things I've worked a lot with is resentment, that people are still carrying wounds from the past. And I say to people, you know, the past is history. Doesn't matter how many times you go over those events, you can never, ever make it a better past. But what you can do is learn from those experiences, but then release the emotional attachment that's holding you back. Now, some people find with forgiveness, if you say you're going to forgive someone, you're saying, oh, what they did was okay to me. Well, no, it's not okay. But what we can do is change that word forgiveness into the word release, I release you from whatever you've done to me, either knowingly or unknowingly, but it's time for me to move forward. And people tend to get that they're doing the forgiveness for themselves, not for the other people. And as I said, with the guilt, I'll talk about the language. People feel like if they do all the things that they're told to do, and the disease still progresses, that there's a sense of failure, that they feel guilty that they haven't done enough. And we don't want to set people up for guilt, that they haven't done enough. And that's where our language can come into, forgiving themselves for not, like I say, having enough veggie juices in a day, or exercising or meditating or hanging on. And grief. It's not just grief about losing other people. Grief can come in many, many forms. Looking at grief of perhaps losing a home or a job or a country or a friendship. But what happens when people are diagnosed with cancer? It's the grief of losing the life that they thought they were going to live. And it's really dealing with, I thought, I never thought my life was going to end like this. I was 33 when I was diagnosed with cancer, and I never at any stage thought my life would end at 33. And it was such a shock that I'd have to then face, my future and what that would be. So I really appreciated having people that I could talk to. When I went to Cancer Support WA, ran support groups and empowered people to make choices. So what I found out with my medical prognosis is that I was told I had 2 months to 2 years to live. There's nothing else that could be done for me. Go home and enjoy my family while I could. I was such a mess. I couldn't eat. I couldn't sleep. I couldn't even talk. I was so anxious and stressed that I was talking like this, because it was just horrendous. And in those days, we had a water bed. I don't know if you remember back in the 80s. I'd wake up in the middle of the night and it was like a tsunami. The whole bed was shaking because I was shaking. My nerves just packed up. And I thought, I don't want to live whatever life I've got left like this. So I went to my doctor for help, and he said, all I've got to do is just prescribe you some Sarapax, which is a drug that would help to relax me. And I thought, that's not really the help that I'm looking for. I want strategies. I want skills. What can I do to contribute to my creation of health and well-being, or just getting through what I'm going through? But there was also a sense of responsibility for family. My family and friends were absolutely, they weren't coping. It's very difficult to have to go home and tell your parents. They'd already lost one daughter before I was born. And here I was going to have to tell them again, they're going to lose another daughter. And then coming home and facing my children who were 6 and 8 and telling them that, mothers, and it just happened to be, I got that information on a Friday before Mother's Day on the Sunday. And I think that was one of the most horrific days of my life. But somewhere amongst all of that, I found that I didn't want to be a victim. And that's some of the language we have, a victim of cancer. But to me, a victim is someone who's hopeless and helpless and can't do anything. And I wanted to find a way that I could empower myself to make a difference. And that's what I've devoted my life since, is to empower people with wisdom and knowledge and education on things that they can do. But one of the things that's very difficult sometimes is to ask for help, because I didn't really know what I wanted or what I needed. There was no roadmap that I knew of that I could follow. So I became very overwhelmed with very well-meaning people telling me things that I could do. But then people also felt like they had to tell me their stories of cancer, and they'd go through this whole story of cancer. And at the end of it, they'd say, and of course they died. And I used to think, why would you tell me that story? So I had to be quite firm on my boundaries at the end. When people started to tell me stories, I'd say, can you just stop for a moment? Has this story got a good ending to it? Because if it hasn't, please don't tell me. My psyche was overwhelmed with all that was happening. But what I found very, very difficult with the oncologist was going back to him. I was told I'd be sent to an oncologist and he would look after me till I died. And when I went in to see him, he looked at my file and he just shook his head and clicked his tongue and went, "You're in the hands of fate. There's nothing I can do for you." So I just thought, well, something came up within me. It's like, well, you don't know who you're dealing with, mate. I'm going to find other ways and things that I can do to help myself. So that's when I set off on this journey. And each time I went back for him to check me out, I'd say, look, I've started meditating. I've changed my diet. I've learned Reiki. I've joined a support group. I'm doing more exercise. And he didn't seem to take any notice of what I was doing, but I thought, well, that's his prerogative. But after 2 years, when I should have been dead within 2 years, I was strong, I was healthy. I never knew you could feel so good when I really started to look after myself. And then he said to me, so how long was it from the primary to the secondary? And I said, it was 10 months. And he said, oh, how long ago was that? And I said, it was 2 years ago. And he said, well, I've got no need to see you anymore. And I thought, well, that's okay. So I bent down and picked my handbag up. And as I went to the door and put my hand on the handle of the door, he said to me, don't you think that it's anything that you've done? He said, there are such things as spontaneous remission. And I found that very, very difficult as language. And we're talking about compassion before. And I've often reflected back and thought how much nicer it would have been if he said to me, look, Kath, I don't understand anything that you've done. I mean, we're talking 33 years ago, so a lot of this stuff was really out there. He said, but if he'd said, well done and keep up doing what you're doing. But what I found is that I was asking other people to help to heal me, but I realized the healing had to come from inside of me. And that's why I named my book, My Answer to Cancer, because everybody I asked, no one else had my answer. I had to find my own answer to bring back that balance. So that was me 33 years ago. My health had broken right down. I had also an illness called bullous pemphigoid, which is when all the tumours in my body, I had 2 large ones removed, but my whole system was completely breaking down. The only reason I show these photos is because that's the state of my health was 33 years ago, and through using my mind and the choices that I have made over the years, I've lived a very enriched and healthy life for these last 3 decades. And I really like this saying. It said, I thought I was lost, so I set out on a journey to find myself. But what I found was that I wasn't really lost at all. I was just looking in the wrong places. And it's look in the right places and you'll be amazed at what you find. And from that saying, it made me realize I was looking outside for other people to heal me. But when I turned around and started to look inside me at my own mind, my beliefs, my experiences, my emotions, I started to sort all of those out and work my way through. Things started to become a lot clearer for me. And that's when I realized the power of words and things that have been said to me over the time and how I reacted or responded to that. And if you look at the word spelling, words, when we write them down, it's called spelling, but I'd never ever looked at the word spelling as, spelling, because words can heal and words can harm. And I know that, as I said before, with the oncologist saying something nice back about empowering me instead of, well, don't you think that it's anything you've done? And we know that I know that I'm talking to people, some of the words that have been said to them, and quite innocently sometimes, but sometimes, they stick in people's minds. And that's where we can help to turn those around to empower them to see things differently. So that brings me to the language of cancer. And sitting in groups, people are petrified of some of the language of, the battle with cancer. They're going to cut me, they're going to burn me, they're going to poison me. And that's their fear. And as hypnotherapists, we know that hypnotherapy works really, really well with the side effects of some of these treatments. And, we can help with surgery, get people, the fear of going into surgery, to get them into a nice, calm state. And we know that people heal better when they're in that calm state. the fear of going and having radiotherapy and the, you know, what that may do to their bodies. Once again, that's something as hypnotherapists we can work really well with. And also with chemotherapy. And I always let people know that instead of sitting there thinking, oh my goodness, that poison's coming into my body, what's it going to do? It's about visualization, visualizing that chemotherapy coming into the body as a healing light, and only going to the cells that it needs to destroy and looking after the healthy cells. But what a lot of the treatment focuses on the physical, but what I found that, you know, sometimes we've been looking in the wrong places for some of the answers for cancer. And they may not be, they may cut out the tumours or burn them out or poison them out. But if things don't change, there's a saying, if you always do what you've always done, you'll always get what you've always got. So if you need your life to change, you need to change your mind. And that's, once again, that power of change, which I think we do very well as hypnotherapists and health professionals in whatever modality that you're working with. So it's what can we do to encourage people to participate in their own healing? It's that sense of empowerment that they are doing something, because I felt like I was sitting on a railway line and I could see the train coming towards me, this big light that was going to take me out. And I was trying to get off the line, but I couldn't get off until I started to link with people who believed and supported me on the journey. So overwhelmed, just didn't know which way to look. This is how most people come into the groups or into me as a one-on-one session. They've got piles of information from everybody. They just do not know where to sit and start, and what are some simple steps that they can move forward to. And that comes back also to the word disease, dis-ease. So, you know, it's like, how can I bring ease back into this person? You know, help them to feel that sense of empowerment. Because, you know, if you're playing with words that we do as hypnotherapists, if you bring someone back into ease, they don't have a dis-ease. There's no dis-ease anymore. Body, mind, spirit, and emotions are addressed and healing. So one of my realizations for me, that the cancer cells that I had weren't invading my body. They were actually my cells, and they'd lost their balance because I was extremely stressed and anxious. I'm not going to go into that story, but, you know, my son was extremely sick as a baby, and for 2.5 years I was on red alert whether he'd live or die. And, you know, people can't sustain a healthy life being at that level of stress and anxiety. And so, you know, addressing those issues, I didn't have the strategies and skills at the time, but that's where my own self-forgiveness came. I did the best I could with the wisdom and knowledge I had at that time. And so I knew that from within me, I had to address a lot of those issues that I'd never taken the time to look at. So how can we create inner peace and wellness with people? How can we support them to do this? You know, as you know, with hypnotherapy, emotional is a great place to start. Where are they at on the wheel of wellness? Intellectual, you know, what are they, you know, might have developed a lot of ways intellectually, but what about the creative side of them? What's been done with that? Looking at the physical, and exercise doesn't always have to be about going to a gym. It can be simple as movement with yoga, Tai Chi, walking, just getting the body moving. And there's a saying, the body needs stillness in the mind to heal, and it needs the body to move. So there's that balance of movement and stillness. Talk a little bit later about the social side of things, the environmental, the financial. So as hypnotherapists, we're looking at people holistically, at whole. How can we support them? Now, what we're talking about now with wellness is not a new concept. You know, back, you know, although years ago, Thomas Edison said, the doctor of the future will give no medicine, but will interest his patients in the care of the human frame and in diet in the cause of prevention of disease. And once again, I think as healers or as professionals that we're all working in this community, and I like the word community, it's a common unity. We all have this common unity that we want to help people and relieve suffering and empower them. And that's where we can come in and teach them and support them to make those changes. So meeting the challenge of cancer can be huge for some people, but it can also be a stimulus of growth, and it can promote an appreciation and gratitude for life. Because, you know, there is though that thing of life. Some people just are in survival mode all the time, and they focus on all the things that are going wrong in their life. And sometimes it's nice to point out some of the things that are actually going right in their life that they've never had the time to discuss with somebody. But what it also does, it brings an opportunity to reflect and make changes in their life. People have often said, oh, I knew I wanted to do this, but I never had the time to do it. And I know one man that had an effect on me when I was telling him all the things he could do to help to bring back balance into his life. He said, Kath, it's easier to die than to change. And I was really taken by that statement of him. And that's when I realized, once again, as hypnotherapists, we are the catalyst. We are the people who can help people change. And if you've been working in the industry for quite some time, you'll have seen massive changes in people once they change their mind. So change comes in again with Charles Darwin, and his quote was, "It's not the strongest of the species that survives, nor is it the most intelligent that survives. It's the one that's most adaptable to change." And I think all of us have had a huge lesson in change over the last few years with COVID. You know, we've all had to change our lives. I don't think there's anybody that hasn't been affected or had to change the way they work or live or experience life. And some it's been very, very challenging because people find that difficulty to make those changes. So where can people start? Where can we direct them? And I wanted to give you some links to a few resources if you'd like to know more about some of these things, because I didn't know where to start, but I was put in touch with a Dr. Ian Gawler, who in Australia is known as one of the pioneers of body-mind medicine. And he has written a book called You Can Conquer Cancer. And he knows you can conquer cancer because 48 years ago, he had a sarcoma on his leg. It spread through his body. He had his leg amputated and he overcame cancer. And he's led people, thousands of people through their journey with cancer. And he explains everything in this book. And so I have been teaching his work in programs that with Cancer Support WA, it's now Solaris Cancer Care here in WA. All of these issues that Ian talks about in the book, You Can Conquer Cancer. I would see remarkable things happen for people, and people come back and say, gee, I never knew you could feel this well. There'd be other skeptical people who would say, where's the scientific proof that this works? So I was very excited that about 5 years ago, another book came out, and it was called Radical Remissions. And this was written by a Dr. Kelly Turner. Now, she was doing research on people with counselling with people with cancer. And there was one woman who had overcome cancer that was told she had a terminal prognosis. And she said to this woman, what did you do differently to everybody else that put you in this position of, going into remission? And this woman said, well, nobody's ever asked me, but started to explain all the things that she had done. And a light bulb came off in Kelly's mind, and she decided to do her PhD and did research into 1,000 documented medical cases of people who were given a terminal prognosis and who had survived and are thriving. And that's what she based her book on. Now, she identified 9 areas, but then after a while of rereading and linking with other people, she actually found there was 10. There was one that she missed. So she rewrote the book, which has only came out about 2 years ago, and it's called Radical Hope. So the 10 things that we as professionals can empower people with is, the first one is optimizing nutrition. Now, I'm not a nutritionist, so I don't give advice. I suggest to people that they go and get professional advice on this, because the old saying of one man's meat is another man's poison. Different people have different treatments. You don't know how they react or respond to that situation. Exercise, that was the 10th thing that Kelly had not actually identified. But when she looked back over her research notes, she realized that each one of them had done exercise. As I said before, it wasn't about going to a gym, because a lot of people link exercise to going to a gym, but it was about moving the body, whether it be through Tai Chi, Qigong, yoga, walking, but it was moving the body. And we actually have a professor here in WA who has done a lot of research into that. It's Professor Rob Newton at Edith Cowan University here, and he's becoming world renowned for the difference it makes for people who exercise going through treatments with cancer to people who don't. All of these people use complementary therapies, and I really want to stress the word complementary. A lot of people still use the word alternative, which puts a lot of stress on people. It's alternative kind of means I'm going to do one or the other. But science has come so far in the 33 years that I have been working with cancer. You know, you get the best of both worlds. And I say to people, do what the doctor tells you to do. They've got so much information there, but these are the things that you can do, which comes back to the integrative medicine. But by taking control of the health, the things that people can do, that's why I say, let the doctor deal with the cancer, you can deal with the health. And that's where we can help people change, to get them interested through hypnotherapy in exercise and the benefits of exercising. Also, looking at intuition. So many people had gut feelings about things weren't right in their body. I know with me, when I had the little red dot on my arm, which was the melanoma originally, and I asked the doctor to take it out, he said, there's nothing wrong with it. And I said, please, could you take it out? And he said, oh, well, all right. So he took it out and then came back and said it was a melanoma. And people said to me, why did you insist on getting it out? And I said, I don't really know. It's that intuition. I just knew there was something wrong with it, even though it didn't look that drastic. And then it was about releasing suppressed emotions, increasing positive emotions. Research has shown that embracing social support, we need a community around us. Now, if people haven't got that cancer support groups, which I've been running for 30 years, even getting into a sporting group, a tennis group, a yoga group, a church group, find your tribe so that you're not alone and you've got people to support you. But there also is about finding strong reasons for living. And I know my strong reasons for living were my children. I wanted to see them grow up. I didn't want to leave them at the age of 6 and 8. And my rewards for doing the work that I have done is I now have 4 beautiful grandchildren, which bring me so much joy and happiness, which increases my positive emotions. So it becomes this cycle of health and well-being. Also, what Kelly has found is that there are thousands of stories out there of people who have overcome cancer that have not been studied. So she has a website. This is for your reference. If you'd like to look it up, is radicalremission.com, and people have uploaded their own stories about what they have done to overcome cancer and other life-threatening illnesses, growing more. So that's another resource. But as we all know, it's the power of the mind which really makes the difference. I know that while I was stressed and anxious, I couldn't make informed decisions because there was just too much going on for me. And when I steadied my mind, I started my healing journey with meditation. And then when I realized how powerful my mind was, it was about 18 years ago, I studied to become a clinical hypnotherapist so that I could help others. because that's one of the hardest things. The prison to escape is our own mind. We only think the way we think because we think that's the way you think. And it's not till you explore that and get yourself out of those confined restrictions that the world starts to open up with other possibilities for people. What I also found is that some of the great art masters were giving us hints centuries ago about the power of this greater power that we have. And Michelangelo in the Sistine Chapel, and you would all recognize, I'm sure, this painting, and it's called Creation. And so, you know, the power in this great wise person is reaching out to Adam, who is representing humankind, mankind, and he's reaching out, and Adam's sitting back there quite relaxed, not even trying to connect with him. All he has to do is actually lift his finger up and they would connect. But he's very apathetic as he sits back there. But what it can be interpreted as is the power of the mind. And that when we link ourselves to the power of our own mind, when we can help others connect to the power of their mind, we can create a whole new life, a whole new belief system, and a whole new journey for people on this, what we call the cancer journey. And also realizing that people see the world differently. And so it's about being non-judgmental. We don't know what their memories are, their values, their attitudes, beliefs, and feelings. And that's what we need to respect. And the one thing that I used to get, well, I'll get feedback all the time about people saying, I love talking to you because you're so non-judgmental. It's about accepting people where they are and taking their hand and going on the journey with them without judging them in any way. Because sometimes in those old memories and old beliefs, there's an old lie that's lying in the middle, connecting them to the world. And as you know, we know about changing beliefs, we can change people's reality when we let go of the old lies. So it comes into PSYCHO-NEURO-IMMUNOLOGY, because we know that emotions affect the immune system through messenger molecules and nerve impulses. But emotions also influence the choices that we make. And it's the old thing, when you're highly emotional, you don't make big decisions about life. It's about settling those thoughts and those feelings.
Cathy,
yes.
Sorry, I really, you know, I'm loath to have to interrupt, but I'm just noting the time.
Yep, I'm just about
you
to
could kindly wrap it up because we have lots of people with many questions for you. There's a lot of wonderful comments put to you in the chat. So yeah, just if you could wrap it up in about 1 minute, if
that's
possible.
just coming into the winding up now.
Oh, lovely, thank you, Cathy. Thanks.
So winding up with it is emotion is emotion, which is energy in motion. And when we can release those blockages from people, we can get that motion. And also, I like the word intimacy, and that's our privilege as hypnotherapists and as healers, doctors, whatever modality we're working. It's the intimacy, it's into me see, that people trust us enough to let us see into their minds, into their lives without that rejection. So it's about responding to people, not reacting to people, because when you react to people, you're reenacting something that they may not understand. So one of the other resources I'd like to give you is I work with this as well, the Allevi8 app. It's Dr. Ian Gall has given all of his, he wants to alleviate suffering in the world. So this is a free app, costs nothing for anybody. That all of his meditations are on there if you want to give to clients in between times, in between your sessions. That's another resource for you. So just in conclusion, looking at body, mind, spirit and emotions, bringing them all together and dealing with the person as a whole. So stop the share. So sorry about that. I do get a bit excited.
No need to apologize. Thank you, Cathy. That was very, very emotional and also very inspiring. all at the same time, and I can see from the many messages that are coming through from the chat that, you know, that's very much felt amongst the entire audience here with us today. We've all found you to be very inspirational, and it gives, you know, it gives us hope. So many of us, too many of us, are touched by cancer in one way or the other. So you are truly someone who gives us hope. I don't really have very long to put the plethora of questions that we've got here for you. I'm going to put the first one that came through. So that was, you know, quite a few minutes ago, probably 20, 30 minutes ago. Now this is from May Teng in Malaysia, who has said, "Hi Cathy, I'm a breast cancer survivor diagnosed at the age of 34 in 2019. It is not often spoken of, even among patients and survivors in the support group. I would like to ask about the culture of toxic positivity. What is the most appropriate thing to say to encourage those newly diagnosed from cancer survivors without being toxic with the positivity?"
It's a really, really good point. And, you know, we often address that in the groups, that people get guilty that, you know, if only I stay positive, I'll be okay. And that's not the case. To me, I say to people, sometimes you're going to have days where you're going to just sit there and cry. And that's the emotion, letting that emotion out. But because you cry or because you feel angry or you feel those emotions, it doesn't, it's not going to damage you anymore. So it's about being healthy and realistic and positive with it. Don't try and keep that mask on all the time. Let you have someone you trust that you can express those fears with.
Got another question here from Silvana in Australia. Cancer question. Cancer is a physical and psychological illness. How can we empower patients with comorbidities such as disempowerment, depression, and hopelessness?
Well, for me, I found a lot of those things help to be resolved because it's the stories we're telling ourselves in our own mind. And so when we can teach people, you know, with hypnotherapy, but mainly I also teach meditation. It's something that empowers people to still the mind, let those stories go. It's the stories that are creating a lot of the tension within the body, and they start to dissipate. So people do meditation for 2 or 3 days and say, well, this stuff doesn't work. Meditation is a thing that you do every day, like you clean your teeth and you have a shower and you make your bed. It becomes part of who you are. Then you start to settle all of those. And the word disease doesn't only mean with cancer, it can be Crohn's disease or arthritis or lots of other aspects. Doesn't mean to say there's a cure. And that's the one thing Ian Gawler taught me. He said, if you're doing all of this stuff because you don't want to die, he said, I've got some bad news for you. He said, we're all going to die. But what I want you to do is live the best possible life you can for as long as you can. So I hope that's helpful.
Thank you. I've got another question here from Christiane Taylor. How can staff members support a colleague who has been diagnosed with cancer?
The best thing is to get one person to talk to that person with cancer and ask them how would they like it dealt with. I've had people come back. Some people say, look, I went to work, not one person spoke to me. They all avoided me because they're all too frightened. I'll start to cry. Other people say, well, I'd like to let one person know where I'm at and they can let everybody else know so I can just get on with my work for the day. There is no one answer except for ask the person what they would like. Don't assume.
Sure. Okay. We've literally got a minute and a half left. So I think I just want to read to you some of the messages that have come through. And I'd like to ask if it's okay that there's a few other questions that we'd like to send to you via email, Cathy. Yeah, and if you wouldn't mind just putting some responses back to us, and then we'll share them with all of the delegates post-conference. But I'm just going to read a couple of the messages because we've literally got seconds to go. Thank you, Cathy. Absolutely inspirational. I'm a nurse who used to work in oncology and cancer support and can completely agree with all that you've said. Thank you. That comes from Christine Roy. We've got from Kirsty Nicholson. Beautifully done, Cathy. Thank you so much for that wonderful and in-depth presentation. Very helpful. Other people are commenting how very empowering it is listening to you. Thank you, Cathy. Truly brilliant. What an amazing woman. Thank you so much, Cathy. Thank you, Cathy, for sharing your inspirational healing journey. So, you know, that's what you've given us today. A lot of empowerment, a lot of inspiration, and a lot of hope. And, you know, on behalf of all of us here, and on behalf of the LSCCH and LCCH Asia Group, I'd like to sincerely thank you for joining us, Cathy, today. I know that obviously in Australia, you're now what, about coming up for 8 o'clock in the evening on a Saturday evening. So thank you for giving up your valuable time. It's been an absolute pleasure hosting you. And I'll be in touch early next week with the questions that we haven't been able to address here.
Thank you.
Thank you. Thank you very much. And we'll be delighted if you choose to stay on. You're welcome to stay on. You're welcome to come in and out as you want. And thank you.
Thank you.
Take care.